Good afternoon, it's Dan Lyus here from Weekend Repair. I'm the Director of Development and I'm here to give you an update on the Bristol Better Care Commissioning Transformation Board that happened yesterday, so that's Tuesday the 23rd of February. And I'm doing this because I'm the VOSCA rep for the VCSE sector. So it'll be a quick update. The meeting was a quick meeting, probably about an hour and 20 minutes, and there was about 12 items on the agenda. I'm just going to pick 4 of them. So one follows on from the last video, if you've seen the last video, and that was about there was going to be a meeting of kind of a leadership team to look at what the future should be for the Better Care Bristol and how it will go forward. That happened, and we received an update. So the meeting had happened between key members on the board, as well as the mayor and some of the chief execs of the key organisations. So I'd assume the acute hospitals, etc. And VOSCA were represented in that meeting. And the notes on it talk about that got shared at the meeting, talk about the need for a real recognition for a step change in the way in which Better Care Bristol operates, so that it can have the size of impact that it needs to have given the scale of the challenge. And the team that went there really felt that they got from the meeting the mandate to come up with a kind of a step change plan. So we'll wait to see on what comes through from that. Interestingly, within that update we heard how there's going to be a increased recognition and role for covering mental health within Better Care Bristol next year. This connects in with the whole Parity for Esteem agenda. So that was really good. That was a good update there to hear on the future of Better Care Bristol. So just looking at my notes, the two items back to back were on business cases. So this is where the transformation board, are being asked to critique and strengthen proposals that will seek to draw down or use some of next year's money. So there was a projects connected to the quality of care within care homes, and also the delivery of 7-day social care services in and around hospitals, around the brokerage of care packages, etc. So that, as we move towards greater integration, people are supported 7 days a week, not just with their healthcare, as is in the news at the moment, but also with their social care, because I think it's the second largest reason for delayed transfers of care is the unavailability or the lack of timely availability of social care packages, such as domiciliary care. 2 business cases there, they were talked about and challenged and strengthened, I think. And so they'll either now need more work before they go up to the transformation board, or they may well go through there relatively quickly. There was an item of significant relevance for the sector, for our sector, on community webs. So this item, it kind of previously been discussed by the board before my time, and money had been set aside for a post. This is a post that will probably be employed through the CCG, but working very closely with primary care and then voluntary and community sector organisations in one given locality in Bristol. And so the discussion was about how to award the area that would first test the concept of community webs. So community webs is a relatively sort of it can sound a bit complex, but basically it's about ensuring that in a community there is a whole range of vibrant and available support and services, either between individuals or organisations, that can really take the pressure off the primary care system and alleviate strain when people are turning up to primary care for reasons that are not really medical, and the primary care system can be reassured that within the community there are services that can support, and so the community web implementation manager or implementation coordinator would be all about ensuring that rich availability of options that are closer to home and more connected to people's lifestyles and less medical. So that was discussed, and actually the vast majority agreed, and it won't be long before a small procurement process is started to choose the area and get that underway, because I think they want it underway within Q1 quarter one of 2016-17. So final item, sheltered housing. There was just an update on research that had been recently done into sheltered housing in Bristol, which was very interesting. Just one scheme. Somebody had looked at, I think it was a GP actually, had looked at quite closely the admissions to hospital that had occurred from people within a certain home, and actually what they determined was that in all instances that they had looked at and assessed, the admissions were for completely the right reasons. And so there was a discussion about whether it's possible to generalise from that case across a broader range, or what there was to learn about that situation that could help improve the likelihood that people only do get admitted from care settings for entirely the right reasons. Okay, so that was the update, and I will see you again next time. Take care, bye bye.